For 5 minutes, Mr. Gosar.
Thank you, Madam Chairwoman. Dr. Scott, you were just accused of spreading misinformation. Would you like to address that comment, please?
Thank you, Congressman, for the opportunity. I think that there is data available to support everything that I have said today, and I've provided references to the committee of what I have said. It's unfortunate that the politicization of this issue has affected the medical organizations as well. But as an OBGYN, I went into this practice to care for 2 patients, a woman and her unborn child. And I continue, because in my conscience I cannot do otherwise, to advocate for the life and health of both of my patients. That is the right thing to do.
Well, I agree with you, and we're seeing that same discussion here, you know, with what we claim to be a science within the COVID-19 discussion as well. So now, as a healthcare provider, we all know that patient autonomy is the foundation of all healthcare decisions. Informed consent respects that doctrine. I don't agree that abortion is healthcare, but assuming it is, all pregnant women receiving an abortion death pill should be told of the risk of the toxic brew they are swallowing, including the impact to future fertility. To your knowledge, are women being told that by taking this pill they may impact their future fertility and not be able to have children in the future? And if not, why? Can you discuss these ramifications?
I do not know specifically what is being said in abortion clinics, but I do know that many states have mandated the discussion of complications, and in fact, the FDA, under its risk evaluation and mitigation strategy, mandated discussion of complications as well. What we do know, and what I have seen frequently in the emergency room when I have cared for women having complications from medical abortions, is that it results in complications very frequently. Records linkage studies from Europe tell us that medical abortions have complications 4 times as frequently as surgical abortions. Very good studies and meta-analyses tell us that between 5% and 8% of women who receive a medical abortion do not pass the tissue completely or hemorrhage and require surgical completion, usually with a D&C. I do not know how many women understand that they have between a 1 in 12 and 1 in 20 chance of requiring a surgery in addition to the medical abortion pills that they receive. I think the number of medical abortions as a percentage of abortions is going up dramatically, particularly in response to COVID. I think there's a very good possibility if women understood the high risk of complications that they might opt for surgical abortions instead. So the numbers of medical abortions are concerning. Additionally, the FDA, because of COVID, removed the in-person requirement for medical abortion dispensing, which means that a woman does not need to have an ultrasound to find out exactly how far along she is. I've seen many women who perhaps underestimate their gestational age. They're much higher risk to fail if they're at a more advanced gestational age. They're no longer making sure that it's not a pregnancy outside of the uterus that could rupture, because medical abortion pills do not affect a pregnancy in the tube, and women have died from that. They do not evaluate Rh status, in which case a woman may, in a future pregnancy, if she needed the RhoGAM injection and did not get it, she can form an immune response to her future children. And 14% of those children, if they are untreated, will be stillborn. Half will suffer neonatal death or brain injury. There are some very significant complications that can occur with unsupervised medical abortion, and for some reason the FDA is choosing to look the other way on that.
So let me get this right. I have just limited time. There's preoperative screening complications if we don't screen, and there's complications post-abortion based upon those same screenings or additional factors.
That is correct. There's a lot that women probably do not know.
Gotcha. Well, I have very limited time. I'll yield back. Thank you, Madam Chairwoman.
Thank you.